So, our topic is renal cancer. Let's start with the introduction. Malignant cancer cells are developed into the tubules of the kidney, which leads to renal cell cancer. It grows and starts to destroy other cells and tissues nearby surrounding it. If it is not treated early, its abnormal growth can form a massive tissue-like structure called a tumor. Now we'll see how nutritional therapy and diet affects in renal cancer. What is nutrition? So basically, nutrition is nourishment or energy that is obtained from food consumed or the process of consuming the food in proper amounts of nourishment and energy. An example of nutrition is eating a healthy diet. But when renal cancer is treated, approximately 50% to 80% of patients develop malnutrition during their process of treatment. Thus, nutrition plays a huge role as it supports in preventing and diminishing the progression of malnutrition. Inflammation. So, when treatment is going on, there is a disorganized immune response while the body is getting treated for renal cancer. It suppresses the active immune response by inducing immunotolerance. So, to avoid inflammation, it is necessary to have anti inflammatory foods. Anti inflammatory eating. It helps in the risk of cancer and improves blood pressure. You should avoid eating food which causes inflammation, such as processed foods. Should avoid excess meat, especially the red one. Should avoid saturated fat and should focus on more plant-based diet. Now, what is plant-based eating? Plant-based eating is eating food that are high in vitamins, minerals, and fibers. Foods which are high in phytochemicals. Phytochemicals give plants color and flavors. They are good cancer and inflammation fighters. Intake of beans, seeds, and nuts is also very helpful in plant-based eating. It is not necessary to eat just fruits and vegetables in all meals. During your meals, you have to divide it approximately like 1.5 cup of fruits, 2 to 3 cups of vegetable daily. This is plant-based eating for patients with renal cancer treatment. They can substitute proteins for protein source they can substitute beans instead of meat. They should simply avoid processed sugar. The plant-based eating is good source for minerals, fibers, healthy fats, and it's an entree for protein if used instead of meat. If it is eaten seafood is consumed once or twice a week, it is very beneficial as it provides some omega-3 fatty acids. Fatty fish like salmon, it has good amount of omega-3 fatty acids and it is low in saturated fats. Healthy fats in cooking and eating can be added by using cooking oils like extra virgin olive oil and nuts, seeds, or avocados used for garnishing. The patients can switch to whole grains of food instead of refined grains. They can switch to food which has more fiber, more vitamins, minerals, and which are less processed. They should have food which has whole wheat components in it, which have complex carbohydrates, which are good in phytochemicals, such as old-fashioned oats, quinoa, whole wheat bread, etc. Patients should consider going on low protein diet sometimes because some dietary protein restrictions reprograms anti-tumor effects during immunotherapy. It enhances the immunotherapy and gives better results in curing the renal cancer. In many studies, the one which we have considered, it shows exposures associated with the incidence of RCC, renal cancer cells. Meta-analysis were performed and conclusions were derived. They saw healthy dietary patterns and unhealthy Western patterns, where drinking patterns, eating of dietary products like fish, total fat, sweet carbonated beverages, beer, vitamins, riboflavins, saturated fats, vegetable fiber, and cereal fiber, many of these such things were included. Vitamin D is also very essential in determining the renal cancer cell risk. The exact anti-carcinogenic mechanism of vitamin D is not known yet, but dietary intake of vitamin D accounts for a very small proportion of vitamin D levels However, it is not yet known how it works in anti-carcinogenic mechanism. Although the thought to impede carcinogenesis by stimulating cell differentiation, inhibiting cell proliferation, and apoptosis was seen using vitamin D.
Arsenic in water. A small study from Taiwan showed a significant positive association with renal cancer. Exposure to arsenic was measured in drinking water or well water in the areas where the study participants lived, and exposure values were individually estimated according to the time they lived in that area. The International Agency for Research on Cancer (IAR) grading of arsenic and its compounds as class 1 carcinogens, and they are very much carcinogenic to humans, arsenic and its compounds, because they cause chromosomal abnormalities, inhibition of DNA repair, and an increase in cell proliferation. In addition, arsenic in drinking water is well absorbed in the gastrointestinal tract, and both inorganic arsenic and its methylated metabolites are excreted in urine. Renal diet. People with compromised kidney function must adhere to a renal or kidney diet to cut down on the amount of waste in their blood. When kidney function is compromised, they do not filter or remove waste properly. A renal diet is one that is low in sodium, phosphorus, and protein. Because it also emphasizes the importance of consuming high quality protein and usually limiting fluids. Some patients may also need to limit potassium and calcium because every person's body is different, and therefore it's crucial that each patient works with the renal dietitian work to come up with the diet that is tailored to the patient needs. Sodium. Sodium is a mineral found in most natural foods. Foods we may eat contain salt, or they may contain sodium in other forms. Processed foods often contain higher levels of sodium due to added salt. Too much sodium can be harmful for people with kidney diseases because their kidneys cannot adequately eliminate excess sodium and fluid from the body. So, tips to monitor sodium intake, like use fresh rather than packaged meats, choose fresh fruits and vegetables, or no added no added canned and frozen produce. Use spices that do not list salt in their title. For example, choose garlic powder instead of garlic salt. Limit total sodium content to 400 mg per meal and 150 mg per snack. Potassium plays a role in keeping the heartbeat regular and the muscles working correctly. Potassium is also necessary for maintaining fluid and electrolyte balance in the bloodstream. When the kidneys fail, they can no longer remove excess potassium. So potassium levels build up in the body. High potassium in the blood is called hyperkalemia, which can cause muscle weakness, irregular heartbeat, slow pulse, heart attacks, and death. So tips for this one is talk with a renal dietitian about creating a eating plan. Limit milk and dairy products to 8 ounces per day. Avoid salt substitutes and seasonings with potassium. Phosphorus is a mineral that is critical in bone maintenance and development. Phosphorus also assists in the development of connective tissue and organs and aids in muscle movement. When kidney function is compromised, the kidneys no longer remove excess phosphorus. High phosphorus levels can pull calcium out of your bones, making them weak. This also leads to dangerous calcium deposits in the blood vessels, lungs, eyes, and heart. So, excessive calcium is also dangerous. Tips for this one is eat smaller portions of foods that are high in protein at meals and for snacks. Avoid packaged foods that contain added phosphorus. So, look for phosphorus or for words with PHOS on ingredient labels. Ask your physician about using phosphate binders at mealtime. Fluids. In the later stages of chronic kidney disease, where normal food consumption may cause fluid buildup in the body, which could become dangerous. People on dialysis often have decreased urine output, so increased fluid in the body can put unnecessary pressure on the person's heart and lungs. Patient fluid allowance is calculated on an individual basis depending on urine output and dialysis settings. So the tips for fluid is not drink more than what your doctor orders. Count all foods that will melt at room temperature. For example, jello, popsicles, ice creams, etc. Be cognizant of the amount of fluids used in cooking. Conclusion. So to sum it up, patients should follow the renal diet plan to lead a healthy life and to avoid certain food types which will make the kidney to not function properly. Minimal consumption of alcohol have no effects on the RCC. Phytochemicals and vegetable secreted compounds play an important role in blocking the carcinogenic enzymes without activating it. Thank you.